everyone, it's Dr. Brooks. Welcome to Healthy Kids Corner. Thank you so much for joining me this fun day. Today we're going to talk about pervasive developmental delay. I've tried to do videos on autism, Asperger's, PDD, which is pervasive developmental delay, really separately, although they are part of the autism spectrum. So I've just been trying to do little videos on kind of education about each of them. So today we're going to focus on PDD, which again is pervasive developmental delay. So PDD often is diagnosed as pervasive developmental delay not otherwise specified, also called PDD-NOS. This diagnosis of PDD-NOS is often given to children that do not meet all the, quote, criteria for an autism spectrum disorder, i.e. autism or Asperger's, and it tends to be given to smaller children. So if they have a child at 18 months, 24 months, 36 months, and they're not quite, convinced when they do their testing and their evaluation, they'll often be given the PDD-NOS, which will, a lot of times if it goes untreated, it will turn into autism, an autism diagnosis. So there are studies to suggest that persons with PDD-NOS can be placed in one of the three different subgroups. The first one is a high functioning group, around 25%, and those are children whose symptoms largely overlap with that of Asperger's syndrome, but who differ in terms of having a lag in language development and mild cognitive impairments. So with Asperger's syndrome, it does not generally involve speech delay or cognitive impairment. So I did do a YouTube on Asperger's, so you can watch that specifically. The second group, around 25%, are those children whose symptoms closely resemble those of a child with autism, but do not fully meet all of its diagnosis signs and symptoms as far as giving them that official stamp of diagnosis of autism. And then the third group, around 50%, they meet all the diagnostic criteria for autism, but whose stereotypical and repetitive behaviors are noticeably mild. So I like to differentiate those so that you know if your child or if a child has PDD, there are different subgroups that they fall into. So I've explained a little bit about what PDD is and the different subgroups. So let's talk about symptoms that you see with a child with PDD-NOS. These are characterized by delays in the development of socialization and communication skills. Parents may notice an associated behavior as early as infancy and know that something is, quote, not right. These may include delays in using and understanding language, difficulty relating to people, unusual playing with toys and other objects, difficulty with changes in their routine or surroundings, and repetitive body movements or behavior patterns. Again, your child can exhibit one of these or all of these and have a PDD-NOS diagnosis. I will say that you don't need to have a diagnosis if your kid is doing these, quote, odd behaviors or different behaviors. Then I would really tell you to get out there and get care for them, specifically around the functional medicine and biomedical approach. These approaches are really what I do in practice, but they really examine what's going on the inside of a child's body so that you can fix some of the core issues that are giving you the symptoms that are making them PDD or autistic or Asperger's. So caring for your child with PDD is something that you need to give some thought to. A lot of people want to know what it is. And so once you know what it is and you have a label for it, then the hard part is what do you do with it? So here in my practice at Whole Child Wellness, we believe in an integrative approach. That is really the key to true health and wellness. So in other words, I believe that many symptoms seen in children are caused by a combination of factors that include certain food products, chemicals, as well as external toxins, geographic location, weak immune systems, vaccines, dysfunctional nervous systems, and abnormal detoxification. And I know that's a very long list, but each child that comes in the practice with PDD-NOS has a multiple of those issues as far as a combination of factors. So the only way to truly get wellness for them and improvement is, as far as medically speaking, is to really get down to the nitty-gritty of what's going on. So I think it's important to integrate nutrition, diet, supplementation, biomechanical and functional methods to help the child with PDD. Irregularities in their body happen, right? And so nutritionally, you need to balance those. You need to give supplementation. Also, chiropractic care can really help children that are having these, I would say, more biomechanical issues with kind of balancing out their nervous system and helping calm them, helping keep them healthy. And then of course doing digestive support and lab testing, also really important. So I've done some other YouTube videos on those specifics, so you can see those for some more information. Many have given testimonies in our practice to the dramatic improvements that they've seen, and you can look at those on our website at mychildwellness.com under the testimony tab. I think it's important for you to seek out somebody who does functional medicine for your child or known as a biomedical approach. These are real important because these are the doctors that will work with the therapists that you're already seeing, occupational and speech therapy, etc., to really help you figure out the full puzzle of what's going on so that you can have wellness. I have yet to see a child with PDD-NOS that doesn't have an underlying GI condition, diet, or food issues. So it's really important that you get a hold of that as quickly as possible. And because these children are often diagnosed with PDD-NOS as early as, 15 months, I've seen the youngest child that I've seen is 12 months old. If you can get them under care then, you will really, I would say, skirt some of the issues that the older children have. So again, you can see some more of our YouTube videos. You can check out our website at mychildwellness.com for more information on treatment options. We of course see kids from all over, so if you'd like to come to our practice, that would be wonderful. We welcome you. If you're not in the area or would like to see someone closer to home, you can really, I would just do a Google search for functional medicine, pediatrics, or biomedical pediatrics, something like that, and look for someone there, and then find the right way. I did a YouTube on how to find the right doctor, so you can watch that too. So hopefully that gave you a little background on what PDD is, the symptoms, as well as some of the things that you should be looking for medically to help treat their bodies. We do additional education for parents, webinars. They are free to any parent. You can register for them at dramberbrooks.com. We also do clinician webinars that we do. So if you're a clinician out there, you can see dramberbrooks.com for the listing for you, for courses coming up. We're also on Facebook at Whole Child Wellness, so like us there because I do post some great information on our page. I try to post about once or twice a week, really things that are applicable to the families that we see, and then things that I think typical families are struggling with that I might want to shed some information or share information on. We're also on Twitter at WholeChild4U, and on YouTube, as you know, at Whole Child Wellness. So we do have other videos, so we'll ask that you check those out and see if any of them are of interest to you. And as always, please feel free to share our information and our videos with your friends and family, because I think educating really everybody that we can is really the reason why I sit down to do these videos, to help the people that are not in our practice, but to give them some background on options and maybe some explanations that may help. So I wish you the best on your healing journey. And if you want more information about our practice, it's at www.mychildwellness.com. Thanks so much for joining me. Have a great week. Bye.